A private health giant has won a £2 million hospital contract. Image, Getty. IHI has been closely involved with NHS Scotland for the past decade, earning millions in public money and raising questions over the SNP government's cosy links to the company. The president and CEO is Derek Feeley, who resigned as chief executive of NHS Scotland in 2013 after it emerged he had interfered in critical report on hospital waiting times. Mr. Feeley held a private meeting with the First Minister in February to discuss patient safety, which has become one of IHI's key areas since it launched the Scottish Patient Safety Programme in 2008. 4 months later, in June, Ms. Sturgeon hosted a reception for IHI at Edinburgh Castle with Mr. Feeley and many other senior figures from the firm in attendance. Pierre Barker, IHI's Chief Global Partnerships and Programs Officer, tweeted, "Great excitement as at the strategic partners addressed in the Great Hall of Edinburgh Castle by First Minister at Nicola Sturgeon." Delegates from the NHS and other US healthcare firms were also present to hear Ms. Sturgeon's speech in the castle's historic Great Hall, although her remarks were never made public. The event was held just a week after NHS National Services Scotland (NSS) published its £2 million tender for a national strategic quality improvement partner. Last week, following a question from this newspaper, it was revealed that 2 bids had been received and the one from IHI had been successful. First Minister Nicola Sturgeon. Image, Getty. People will understandably be suspicious about the process through which this high-value contract was awarded. When it comes to the use of private firms working in the NHS, transparency is absolutely key. Miles Briggs, Scottish Conservative Shadow Health Secretary. Scottish Conservative Shadow Health Secretary Miles Briggs said, "People will understandably be suspicious about the process through which this high-value contract was awarded. When it comes to the use of private firms working in the NHS, transparency is absolutely key. If the shoe was on the other foot, the hypocritical SNP would be the first to cry foul." IHI also won the previous quality improvement contract, which was awarded in 2013, and the non-profit firm has been paid at least £10 million by the NHS over the past decade. News of the award came just days after Professor Jason Leach, the Scottish Government's National Clinical Director, attended an IHI conference in Melbourne, Australia. He gave a keynote speech alongside Dr. Don Berwick, the founder of IHI, who said Scotland's progress on healthcare improvement under his firm's guidance was as promising as anything in the world. Professor Leach, who said his career as a dentist and oral surgeon had been turned on its head when he became an IHI fellow in 2005, opened his remarks by making a joke at the expense of the NHS in England. He said, "We're going to try and use Scotland as the example. But Don is right, we're not done. We're better than most. We're better than our southern neighbours." Which southern neighbour you wish to refer to in your head? There's a lot of things southern to Scotland, as this newspaper has revealed. Professor Leach and other NHS staff have made regular trips to an IHI conference held in Orlando, Florida, each December. As well as its work in Scotland and other countries, IHI is also providing the model for a new healthcare venture in the USA by 3 of the world's biggest billionaires. Amazon CEO Jeff Bezos, Berkshire Hathaway CEO Warren Buffett and JP Morgan Chase's CEO Jamie Dimon, who are worth a combined $250 billion, are aiming to shake up the enormous U.S. health market by providing care at a reasonable cost. They are being advised by Dr. Berwick, and the as-yet unnamed venture will be headed up by world-famous surgeon Atul Gawande, who has spoken of his admiration for IHI's work in Scotland. The latest developments sparked astonishment and anger from members of the ASAP NHS campaign for patient safety, which has repeatedly questioned the role played by the firm and another similar organization, the Institute for Healthcare Optimization. Whistleblower Rab Wilson, a founder member of the campaign, said, "For a non-profit organization, IHI seemed to be doing rather well out of the Scottish taxpayer." His colleague, Roger Livermore, added, "The Scottish government must not spend public money on a US system that fails to meet any of essential UK-wide legal requirements on patient safety, a Scottish government spokesman said. This contract tender was managed by NHS National Services Scotland, in full compliance with published procurement rules. Scottish ministers had no involvement. IHI, a leading global quality improvement not-for-profit organisation, were successful in being awarded the contract.